Good morning. An estimated 36 million people in the U.S. have diabetes, and another 79 million people are pre-diabetic. Most of these people suffer from type 2 diabetes. The disease is a burden, but there's some good news. Dr. Stephen Wander is here to discuss a brand new approach to type 2 diabetes that is changing lives. Good morning, Dr. Wander.
Good morning.
I won't call you Stevie Wonder.
Please.
It's Dr. Stephen Wander.
Yes.
You know, those stats are horrible, and it's got to be so frustrating with people with type 2 diabetes that they're doing or seemingly doing everything, but they're not getting better. Talk about that.
Well, they are frustrated. Typically, their first visit to their practitioner was for a general health visit. They get their blood work done, and the doctor tells them, "I'm sorry to inform you, you have type 2 diabetes." And typically, they'll get their first prescription that day, and then one after another, after another, after another. Then typically, they'll move on to their cholesterol and blood pressure medications, and then finally onto insulin. And they're very frustrated because their blood sugars are not regulating. They start reading about the complications: heart disease, stroke, liver failure, kidney failure, wow, blindness, and so they're fearful. And typically the counseling that they get is lose weight, change your diet, exercise, but they try to do that and it doesn't work. And so that's typically, unfortunately, how they're counseled through the rest of their life.
So let's talk about what you're doing and what kind of results you're getting.
Well, we're getting very excellent results with our patients. Number one, we treat our patients as an individual. So what I mean by that is our typical diabetic patient, they're all on the same medications, basic 5 medications. And if the cause for their diabetes is different, then they all shouldn't be on the same treatment plan. So what we do is extensive testing. What we'll do is turn them upside down, shake all the change out, find out the cause of the problem. Once we find the cause of the problem and treat them like an individual, then what happens is they lose weight without exercise, they reduce their medications, they get off their medications, their blood work is better, their energy levels explode, and they just live a much higher quality of life.
Wow. That's pretty amazing.
It is amazing.
So you're basically reversing diabetes?
Every day we reverse it in the clinic. And as long as patients follow exactly what we say and are willing to do what we say, they do great.
Now, it's funny you say that. You qualify your patients, right? You're saying if they do what you say, then all is good. If they don't, what?
If they don't, basic number one priority a patient needs to have is their health to be their number one priority, because they're going to need to make extensive lifestyle changes. Now, everyone's changes are going to be different. Yours would be different than mine, would be different than another person. So once we get the cause of that problem with our extensive testing, then they can reduce their medications, and so we have to qualify them. So we can't take every patient, but if their health is the number one priority, we can help them.
Now, clearly this must be working. You're saying this is working. Can you tell us any examples or anyone who has come back or you've seen the change?
Sure. We have a mother-daughter, Amanda and Sophia, both with their triglycerides at over 280, their blood sugars in the high 200s, their A1C levels in the 8s, which are very bad readings. On their first post-test, both of them triglycerides were in the 80s, off of their medication, A1C levels in the 6s, blood sugars in the mid-100s, which basically they were pre-diabetic, so they weren't even diabetic anymore.
Wow, that's pretty miraculous.
It happens every day.
So with what you're doing, why hasn't that been done earlier? Why are people not doing that? Why are doctors not doing that?
The doctors are typically, they're trained what we call a pill for an ill model. In other words, patient has a symptom that shows up on a blood lab report, and they look at the chart and that says, okay, prescribe this specific drug. So that's how they're trained. So their training leads them to that model, but we know that the outcomes for that model are not good. The research shows it.
So if people want to get a healthy lifestyle, they need to come and see you.
Exactly. And the results are undeniable because you see them on black and white on the paper. So the same physician who gave the person their prescriptions, we send them back to that person with their lab work, and then they're the ones that take them off.
You know, there are so many misconceptions about diabetes. I think coming to a specialist like yourself who knows about it is the way to go, and just get yourself checked out. Yeah, I love what you're doing.
Thank you very much.
Thank you so much. Great job. And we'll be back with more Let's Talk Live right after this.